Please remember to mute your phones if possible, one for the background noise and two, just so we're not disruptive to the other participants that are on the call and on the webinar. We talked about, we started a series last week around the required one-stop partners, and we did get your, we did a poll for priority, and we are going to try to be as close to that as possible. However, unfortunately, we are still working with adult ed on a time frame when they can join us, because that was the #1 priority. So Bethany from KEB, who is our consultant helping us with WIOA implementation, is also working to put our priority order in place. I also want to say we are going to be a little repetitive this morning. We have a lot of new folks joining us. I know there are, and by that I mean there are several community action agencies that are now participating, and so we want to make sure that we're, as much as possible, demonstrating the similarities between the two programs, and then just giving them a little bit of reminder information, but it's actually probably good for all of us. So with that said, and Gail Hedges, the Deputy Director over the Community Action Agencies and the CSBG program, which is Community Services Block Grant, she is here, and so she will be able to answer questions that we have. I also think that we will go ahead and do the presentation and then take questions, but by all means, please type your questions in the chat pod and we will capture those so we make sure we answer everyone. So with that said, Mark, you want to, we're first going to start out with a program comparison, and specifically around eligibility. And eligibility for WIOA Title 1B, which we're going to call workforce development activities, because, as many of you that participated on a weekly basis know, we've said, oh my gosh, what can we call ourselves besides Title 1B? And the WIOA Act actually refers to it as workforce development activities. We serve 3 different populations of folks. It's adults, dislocated workers, and youth. And the eligibility for each, there's general eligibility for that population, which is citizens or non-citizens, and the non-citizens have to be authorized to work. And then you must meet a military selective service requirement. Adults are 18 years or older, and they must have, and there's a priority for adults that either are on public assistance or who are basic skills deficient. And there's a little bit more than that. I'm just giving the general eligibility. So it'll be important for, as we move forward in our partnerships, to get more detail from each other on more specific eligibility and documentation requirements. Our dislocated worker populations, of course, they are dislocated, which is pretty obvious, and they have to be out of work, they have to have a pending layoff, ineligible, or exhausted their UI. Also, displaced homemakers are considered dislocated workers. And youth, that's a significant change, as many of you know, that we've expanded the age for out-of-school youth to up to 24. And also, different from the youth or in-school youth population, out-of-school youth do not have to be low income necessarily. They just have to be not in school and have at least one barrier. So as you can see from the Community Services Block Grant eligibility requirements, there are definitely some crossover. They have to be low-income citizens. However, they have to be within 125% of the poverty threshold, and that threshold they annually adjust. And then in addition to that, there is also an eligibility population that's eligible through Illinois regulations that says that if you're low income and you've been a victim of a natural or man-made disaster, you can also apply for services through CSBG. And Gail, please feel free to jump in at any point if you would like to. Sure. What? There is no age requirement. Okay, sorry, thank you. There is no age requirement. The next kind of overview that we want to give are the services that each of the programs are available through each of the partner programs. And Title I, Workforce Development, does eligibility. We do outreach, intake, and we provide orientations for information and services. We also do, under Workforce Development activities, initial assessments, so we can gauge where our customers are in needing training or other types of services. And then when we work with them around training, we of course use labor exchange services, which are job search and placement, and then in some instances career counseling around labor exchange, and we do employer recruitment and then do referrals to other partners and services. Also, we do a lot of provision of information, certainly training providers, and appropriate training for customers is a big one. Also, what the performance is, and not just specifically about how many folks we get employed, but what is the performance for that training provider? Are they a good training provider, and what is the cost for those? Supportive services is also something that we can offer through Workforce Development, and that's child care, medical or child health assistance, and then you can see we do SNAP, TANF, TANF, and et cetera. And those are basically referrals when we're talking about child support, SNAP, and TANF. We don't actually give funding for that. And then a new thing under WIOA is that we will be required to help file for unemployment and also help folks that need it in applying for financial aid. And then, there's other services that we can do if necessary or appropriate for them to get employment. Then on the flip side of that, for the community action agencies, and you want to flip, thanks. Now, it's important to know, for those of you that aren't familiar with services provided by community action agencies, that not all community action agencies offer the same services. They do tailor their services and based on the location, the area, and what they're able to provide funding for. So I'm going to give you, though, what types of services they can offer, and then if you need to, again, another point for information is, as you work with your community action agencies, getting an understanding of what services or finding out information about what they do provide. One area that they can provide services in is education, and those are activities like workplace orientations. They can help with vocational skills training. They do some family planning. They do for disadvantaged children, cultural opportunities, as you can see, energy conservation. They can provide scholarships. They do GED assistance, and then also nutrition education. They also, and I think this is the important services that will definitely cross as far as is the employment piece. Some of these other services that we'll go over will probably be mainly just referrals that our other partners can make to community action agencies and not necessarily available at the one-stops, which I think, I apologize for not saying this, but for those of you that may not know, community action agencies in the Community Service Block Grant Program, while not a required core partner, are a required one-stop partner and will have to provide services in the one-stop either through technology or actual staff on site. And we're going to go over some of that in just a minute. But this employment will be the primary services that they will provide at the one-stop, either, as I said, on site or through technology. And you can also see that there's a requirement for the CSBG community action agencies to set aside 10% of their funding 10% of their funding for economic development and job creation activities, and I apologize, but they no longer operate that loan program. So Mark, you want to, and we'll update the slide, the PowerPoint to take that off. They also do emergency services, and this, of course, would be something that you all would probably do more of a referral to. But, they do basic needs, do referrals to food pantries, work with community groups and churches, and then some of the agencies will actually provide vouchers or grants if there's an immediate or urgent need. They also, some of them will do things around health services, such as providing transportation to medical. You can access dental screening, immunizations. They do some treatment assistance for drug and alcohol abuse, and then they offer some support services around medication and prescriptions. And then housing is another service, and you can see that they can do renters seeking a residence. They also do education and arbitration around landlord and tenants' rights. They provide some financial literacy for purchasing and financing a home, and then rehabilitation loans for minor energy efficiency and safety-related home repair. The last group of services that we'll go over is income management, and they will do assistance in the form of family budgeting, also provided through workshops or brochures, doing financial management, topics on credit, income taxes. Nutrition is another service, group of services that some of the agencies will also supply, which, community gardening, which is, a big thing in some particular communities, work with food banks, provide food bank services, senior citizens and youth projects. They do Christmas food packages and summer food programs. And then self-sufficiency and coordination of services. There's comprehensive case management, and then they, as all of our programs do, partner with other local governments and community-based organizations. So now that we have just sort of a quick foundation of what each of the services are, I want to just take a minute and go through, I think one of the big things under WIOA for all of us, and which is a good thing, is we have more shared responsibility. And service integration is an important aspect under WIOA. So if Mark, if you wouldn't mind flipping to the next one. I'm going to first, though, start by, and I forgot that my order of my slides, I apologize. I want to first go, though, over the partner roles and responsibilities. And so, of course, we know that all partners in the one-stop are going to be responsible for negotiating into a local memorandum of understanding. Also, this is not just a core partner, adult ed, Wagner, Pizer, or Voc Rehab responsibility, but any required one-stop partner must also support infrastructure costs and shared program costs. And then there's the requirement that you should actually be in the one-stop through technology or on-site services. And the other important thing that we really want to improve under WIOA, that there was some struggles with under WIA, is making sure that the services that we put in the MOU are consistent with what's actually provided at the one-stop. However, it's also important to note that any one-stop partner, required one-stop partner, also has to be recognition and follow what their authorizing law is. And then, of course, we have to provide access through the one-stop, and that includes applicable career services. Can you switch? I want to just briefly go over what is in the MOU, and right now it's pretty simple, but unfortunately MOUs aren't as simple as they are explained for certain. And that is services, which we just mentioned, the infrastructure costs also, which we just mentioned, other shared services and costs, and then how referrals will be made. And the other thing, and for those of you that are in workforce development and the one-stop operators know, we have asked for MOUs to be updated on an annual basis under WIA, but under WIOA, we will change that policy to be only every 3 years. So I think that's a nice and helpful change that is, very much welcome. Just real quickly about infrastructure funding, that is, let me preface before I go over this to say that that is still something that we're looking at the state level, since the governor is required to provide guidance to the state-administered programs on what their contributions or how they should negotiate and what their contributions would be. The law does set maximums for contributions, and that is dependent upon the partner program. The highest maximum is, of course, the Workforce Development Title 1B and Wagner-Peiser, which is at 3%, and then the other ranges are around 1.5% maximum. And the local boards are required to negotiate those costs with the one-stop partners. There is a caveat under WIOA that says if the local board is unable to reach an agreement with the partners, then there is a mechanism that kicks in at the state level to provide that funding. And then, of course, just to repeat that the local MOU will describe how those costs are funded. And also, just another point to repeat, I know that this is, a big deal out there, and you guys are really waiting for guidance on that, and I, certainly appreciate your frustration, and we are working as quickly as we can to get that guidance in order. Now, kind of to tie up back to the services that we went over, these services on this slide are the actual services that are required to be offered in the one-stop centers. And the highlighted services are those that we share in common with the community action agencies. And if you recall in our previous slides, we know that they do orientation, and the workforce development also does orientation. They do referrals, and we do referrals. They do supportive services. They also do follow-up, short-term pre-vocational and financial literacy, English language acquisition, and workforce preparation. So as you're, coming together with your partners, it's important to look at what those cross services are. So, certainly since community action agencies, for example, do financial literacy services, that would be something that you should maybe work with your community action agency as providing on the behalf of, our customers. And so that frees up some of your resources to do some of the other activities and services that, your other partner doesn't or, necessarily doesn't provide. That's also, I think, something when you're looking at shared costs. That would be, to include when you're thinking what services are each of the partners going to provide. So, I'm sorry, I think all I want to say about that, and I don't know, Gail, if you want to say. Okay. So then from a service design standpoint, since we kind of have an idea of what actually these services are, there is a requirement under, well, it's not really a requirement, but an encouragement from the Department of Labor when they sent out our vision for the one-stop system, that any frontline staff that we have at the centers, they be familiar with the basic eligibility for each program. And I think that's another reason for us to do these webinars specifically around the one-stop partners, so we can, gain an understanding of what those eligibility requirements are. And, we need to be certain that we're engaging the businesses, and we're looking at ways to integrate education and training that are creating career pathways. The meaningful access to all customers, that's something very important to be aware of. That is under WIOA, and I think, we're waiting for further guidance on this, but WIOA is in the law requires meaningful access, so you can't just send somebody on their way to go over to the DHS office. You have to make that direct connection. In my mind, it's still a little unclear what exactly that means, so we'll be looking for further guidance from our respective governing entities to give us some hints on what we should be doing there. And then we've talked about a couple of different times that the delivery of those services can be either by on-site, being actually on-site, or they can be through technology. And I also think that's going to be, I don't know about a challenge, but I think we can do some really interesting things around technology. I know just in previous conversations I've had with, various people, that one thing, could be, having Skype and the ability for a customer to sit in the resource center and Skype with another required partner. Mark, you want to go? Finally, technology. We talked a minute about technology. I think, though, we're all familiar or somewhat familiar with Illinois Worknet, and we really want to be able to use Illinois Worknet as a resource, but I also want to encourage, and who's ever not on mute, could you please mute your I would also like to encourage those of you that don't have a Workforce Professional account on Illinois Worknet to get one of those. I mean, there's a lot of resources out there, and helpful guides and things from a Workforce Professional standpoint that you can access and not just provide for the workforce development customers that are WIOA, specifically WIOA eligible, but also any of your customers that you're working with. And as you can see over on the one side, on Illinois Worknet, there's connections to our various partners as well as specific programs that we have on there for you to get additional information or resources. Finally, I just want to give a quick update on regional planning and what are some of the key project activities. I think one of the reasons this is important, and will, as we move forward with our One-Stop Partner webinars, we'll update this accordingly. But, the regional planning process, while we're required to do unified plans, it's important for us to think about what our other required one-stop partners offer and how that fits in and integrates with our regional planning process. So where possible, we want to make sure that we're not just looking at both rehab, adult ed, and Wagner-Peyser for our regional planning, but, for example, what can community action agencies and how does their work fit in with the regional planning process? So to that end, one of the things that we have started doing and have been working on in Illinois and getting ready to roll out to our local system is a regional planning process. And today, one of the things that we do have done right now is a data analysis that is going to help you all identify your target sectors. And one of the important things I think to talk about is, in addition to us looking at statewide target sectors, is as you do your regional planning, what are the specific sectors that you guys will target in your regional plans? Because it might be something outside of healthcare, for example. We know, as a statewide, healthcare is a sector that really has jobs available statewide. But in, up north, we know in the, sort of the Cook-Chicago area, retail and specifically hospitality are big areas. So, and then what we're going to do to kick off this information, and then also beyond just the identification of targets that you all will be working on, we're also going to be providing data around what your populations look like. So you know that you have a high percentage of non-English speaking customers, or what your poverty rates are and other demographics like that. So we will be doing a kickoff webinar that will be open pretty much to all partners, just to explain the process, and then there will be activities that you'll get from that webinar to go back to your local areas and communities to start thinking about, such as you know, who are the appropriate partners and education providers that need to be at the table, as well as businesses. What kinds, we're going to provide some data, but what other data might you have that you want to bring to the table to look at that will inform your regional planning? And then once we do that webinar, there's also going to be some time, and we're still determining how much time will be between the webinars, but we're then going to assemble in 3 different areas across the state, we're going to have regional team meetings, and those will be focused around the economic development regions. And there will be one up in the Cook County area. We're looking at Moraine Valley. There will also be one in Bloomington, and then one in more of the southern part of the state. And we'll get that information out. And then again, once at that meeting, we're going to be looking at resource alignment, start, you know, digging into the data, and we'll finalize the regional planning with a statewide summit where we're going to bring all 10 regions together to talk about and, you know, really outline what your regional plans are going to be going forward, so those can get developed. And those regional plans will inform what we put in the unified planning process. I think a major thing for everybody to understand is we do have a technical assistance firm on board to help us through this process, and you will be assigned a facilitator, so you'll have a consistent person to reach out to and assist you with your regional plans. I kind of already talked a little bit about the regional planning team, except to say that these are the types of partners you should think about when you're starting to assemble your team. Certainly community colleges, economic development should be key. You know, not just, you know, we need to think about more broadly in terms of our education. So what, you know, K through 12, if it's appropriate, voc rehab, and we already talked a little bit about businesses, and then other stakeholders that are determined to be essential in your region. Here's some of the roles that we're looking at as we move forward in the planning. The self-assessment exercise, that is really going to happen at the very front part, and that's the exercise that you'll walk away from after the webinar. Then, of course, we already talked about the statewide summit and the regional meetings, and then, you know, and what that will lead to is the development of strategies and your resource alignment and how you can start to think about integrating services in each of your regions. Okay, so if you have any comments, we did put Adrian Angel, who works for Gail Hedges, as a contact. If you have any related community action agency service questions, of course, if it's workforce development, you can contact myself or Mark, and you guys have our contact information. So that's kind of a brief overview of the Community Services Block Grant Program and how it relates to the workforce development or intersects with the workforce development activities. So we're happy to take questions.
We've got quite a few that have been put in the chat pod. Once we get through these, those that want to ask over the telephone will be able to do that as usual. The first question, someone was asking, does the GED assistance mean classes or monetary assistance from a CSBG funding perspective? And Gail, would you?
It really depends on the individual community action agency. It's handled both ways, and that's why it's so critical that, you know, the partners work together to identify who can do what, and that the MOU needs to be developed to identify what the scope will be for each.
Oh, then don't do it.
Okay,
Please mute your phone.
Next question, will a 3-year review include the resource sharing agreement? That may be for you, Lisa.
Yes, it will.
And
I mean,
okay.
those would be updated, though, as needed.
On that, a question that I have, this is
Sure.
Gail. You said, you know, it doesn't have to be updated except every 3 years.
Mhm.
But if there's a significant change,
Yes.
they need to amend it
Yes, that's
through the
correct.
course of the 3 years, because if auditors come in and look,
That's absolutely right.
and something is identified as being, it's going to be done, and it isn't, it could result in an audit finding for the state of Illinois, and we want to avoid that.
Yes, that's absolutely right. And I do know also, and we should have put this on the slide, and we will update the slide. Although the actual MOU only needs reviewed and updated every 3 years unless it's a significant change, your allocation, we will want to know how you're allocating resources and funding on an annual basis. So that's something also to think about as you're planning.
Okay, we've got a couple of different questions. We appreciate all the participation by the CSBG community. Paul White and Sandra Goldman have questions. They are from the service provider areas, and they're talking about their multiple county representation. Paul's asking, can they provide services at the satellite offices to meet the shared CSBG WIOA responsibility partner requirements at just one of those facilities, because they have multiple one-stop centers as well as satellite offices?
Well, you're definitely required to provide services, and again, just as a reminder, either through technology or on-site at the comprehensive one-stop. As far as providing services at the satellite, that would be negotiated with the local board, and we will have to get back to you on if that meets the shared responsibility partner requirements. My sense is, unfortunately, that's going to be no, because the law is pretty clear that shared costs and infrastructure costs are at the comprehensive centers. What did we do?
What I'm trying to do here, I didn't mean to jump to this so quickly, is I'm going to share my screen because we've got a lot of new people here, and now I've got to get back to the webinar. I apologize. My screen's being slow. What I want to do is share. People have asked how they can get this webinar because we've had people were shut out today. For some reason, we met or exceeded our limitation. This is the first time this has happened as far as how many people could enter the webinar room. And the reason for that is we do have a maximum amount of data space or what have you over the course of a month. And because of that is why we've got limited today at the end of the month. We're looking into this for future months. Hopefully this won't occur, but I was trying to get to the Illinois Worknet pages where you can find these recordings, and for some reason I'm having trouble. Chelsea, can you assist in this for now till I can get back to my webinar page? For some reason it took me totally away from the webinar, and I didn't really want to do that.
Yeah, go ahead and 1 second.
Where I want to do is start off at the beginning where Illinois Worknet starts and show where people can get to the WIOA implementation, but also where they can see those services that were provided on that one.
Can see it.
Okay, so I'm actually sharing. I just don't realize it.
Yes, exactly.
Okay, we apologize. It's learning the technology. So if your screen's up and sharing, you see the home page for Illinois Worknet here. A lot of very good information, a lot of bars across the top that show the programs available through WIOA. As Illinois Worknet continues to get updated, this isn't only workforce services available here. All our partner programs are adding content as well. They're working with the Illinois Worknet team, Jeannie Kitchens and all of her other staff, who have been very helpful in these webinars, but also gathering all this information. So you can see across the top the various main topics, and then if you scroll down, if you're at that page, you can scroll down and see all the other subtopics. But when you scroll down the first main page, you'll see some highlighted announcements, some activity on the right, some upcoming events, and here's where you'll see the program listing that you saw on one of the slides in the presentation, where you'll see a lot of the partner agency links. IDS falls here, the DEI program, some of our specific programs under the workforce system. And then if you want to go to the WIOA implementation site, you can click on the WIOA Works for Illinois. Many of these sites are updated on a regular basis. It takes you to a new area of Illinois Worknet with new headers and drop-down menus. And under the Outreach and Toolkit drop-down, you'll see where you can find WIOA implementation, as well as all of the policy that we develop here through the Office of Employment and Training at Department of Commerce. So if we go to the WIOA implementation site and drop that down, you'll see where we've added the webinars from this Wednesday WIOA webinar sessions. Yeah, I'm trying to, here we go. So when you come down, you'll see all the videos. We've got them aligned in reverse order of how they've occurred. So after today, we'll have this one uploaded. It'll be the first one available here. But you can scroll across all of these and get them. They're a recorded version. You'll hear what this discussion was. You cannot with the webinar in the sense that it's a video recording. You can actually pull this off of YouTube, if I'm correct. And so you can't actually download documents from here, but if you go to the Documents and Updates section to the left of the videos under All Resources, you can get all of these documents. So we've had a couple updates we want to make to this presentation today. We'll make those updates and upload that here, so if you want to go out and get the new version of the PowerPoint presentation, you'll be able to do that. Generally, we have these up by the end of the day, but by the latest, it'll be by the end of the week, so you can come back Friday or next week and view this webinar specifically, especially for those of you who have indicated you've had additional individuals that wanted to participate but were unable to get into the webinar room. They'll want to view this and get the information that was presented. So is there anyone on the telephone that had any questions that needed to be asked? And Chelsea, if you can help me get back to the webinar room itself.
Yeah, can you hover back over where you just were?
WIOA sharing.
At the bottom of your screen?
The Adobe Connect here?
No,
oh, down here,
sharing.
okay.
Yeah, can you click on it? Sorry.
Yeah, it's just like it's real slow, so it doesn't want to do anything.
What, Chelsea, can you just see if there's any questions for us and we can answer them? Okay.
Someone did ask, do you plan on defining what technology exactly means?
I'm not totally sure about that. We can certainly discuss it, but I would think, to some degree we will, only because, it deals with the direct access issue or, meaningful access, but I also think we definitely want to make sure that you at the local level have the flexibility to, define that yourself as well so that you're meeting what your customers' needs are. I know that's not a clear answer, but I think we're still definitely looking into it.
Okay, we're back to the questions now. So following up with Paul's question that we had answered, Sandra Goldman had asked that they're in a 7-county CSBG service provider, and 4 of the counties have WIOA service providers and have had an MOU with one of our or with our one-stop partners since the start. So they are very familiar with what we talked about from the MOU standpoint. This really isn't a question, but that's good to see that the CSBG community understands when we're talking about MOUs that it's not just a workforce services issue. So we're glad to hear that. Jerry has asked, do we have details set for regional meetings and statewide summits, and when is the kickoff webinar?
Is what Pam's asking.
Yeah.
We will have those dates at the end of the week, so we will be, getting those out within the next week to 10 days. I think we did, I'll just, be honest, we did have dates set, but we had a meeting, because one of the things that we're doing in the regional planning is pulling partners, businesses, and education entities together at the state level, and it's called sort of a leadership team. And when we met with them and presented the timeline and really all looked together at what's all involved in the regional planning, it became clear that we had our timeline was too aggressive. So we've taken the last few days to step back and really look at that timeline and adjust it so we all, I know we don't have much breathing room because it's WIOA implementation, but we want to make sure that everybody has the right information and we're really not just creating a plan to, submit to the Department of Labor and our respective federal entities, but something that's meaningful and July 1 of 2016 we can get off the ground and start implementing. And I know one of the things that, is what Julio has been really talking about and emphasizing is that this is just a plan and it can be adjusted and it's, the guiding tool for implementation in our local areas of WIOA. Do we have other questions? This might be our quickest webinar.
Yeah, while we're waiting, Pam's got, maybe has another question. Bethany, if you're on the phone, do you have a idea of what our next upcoming webinars are? Do we have any set for next week? I know
we are still in the
weeks.
work of
Okay.
confirming what topics will go. When we have a list that we're working from, but we're just trying to plug in the dates. So we will just send out an email, hopefully on Fridays, letting you know what the next week's webinar will be. So that's the hope right now.
And Pam, yes, that we will continue to do these comparisons of the other partners. So expect that in the upcoming required partner webinars. And also what we will do is go back and work with Doug Morton from Voc Rehab to do something similar. So, and we'll get that posted in the implementation area and also have Bethany send that out to the full email list of the participants on the webinar. Looks like we have another question popping up. Oh, maybe not.
Again, if you have a question, want to answer or ask it over the phone instead of taking the time to type, please do.
Yes, because the phone is open. We were just asking that you mute. Okay, I'm going to let Gail, do you have any final comments or thoughts that you'd like to share before we sign off?
The only thing, we're continuing to meet internal to Department of Commerce. This is all evolving. I mean, this certainly is new to a lot of the CSBG, the community action agencies, and we've had, Adrian and I and Donna have had a lot of questions about the MOU, what needs to be included, if there are multiple community action agencies, is there one MOU, and what are the shared costs, what are the infrastructure costs, all of those questions we're still working on internal to DCEO. We hope that we'll have answers out soon because both the partners need to understand that, and we just we're trying to figure it out too.
Right, and we're certainly addressing those at the interagency team level, and as we can also, I think one of the other really important points, I know one of our slides just said shared responsibility, but I think that's an important point to stress. One of the big differences under WIOA is actually, the encouragement and the stressing of shared responsibility. So we also are interested in feedback at the local level from all of our partners. One of the things, though, that has come in my mind, and we've talked about very briefly internally and at the state level, is as far as Gail's comment on multiple community action agencies. I know one of the things from a board perspective, if you've got multiple, for example, adult ed providers, they, you know, come together and see who is the lead. And so that might be a strategy at the local level for you all to think about if you have multiple community action agencies in your local area. It certainly doesn't mean that you shouldn't or try to, based on locations, work with all of them, but if, you know, a primary one for the comprehensive, you may want to use a strategy similar to what you do on the boards. Okay, I think we don't have any other questions, and Gail has given us some final comments. So with that, we will, or wait, I don't know if...
We do have a couple more.
Okay.
Mark Loman had been typing for a bit here, so
okay.
We'll wait and see what he has. Again, please utilize the WIOA implementation site to view all of these recorded sessions, especially for those of you who are new to the webinars this week. You'll find a lot of information on the workforce side of it in those previous webinars, more detail on the brief items that Lisa included in the beginning of the presentation today. So we hope you find some valuable information in all those webinars.
And Mark Lohman had a question. I didn't say these dates because I'm not sure. These were the original tentative dates for the regional first set of in-person and regional meetings, which was October 20th, 21st, and 22nd. He's asking if those should be taken off the calendar. I would say this: we have not canceled the locations for those yet because after the end of this week and we regroup, you know, we'll make a final determination. I would imagine, though, you're absolutely correct, Mark, that you can, you know, take that off your calendar. But please, you know, just wait till Friday or Monday to do so. Yeah.
Okay, I think that is all that we've got this week. Appreciate the participation. We will get information out through Bethany on next week's webinar, but you can always come to this page on Wednesday to see if we are holding a webinar. We'll have the welcome screen up, or if we've canceled the date because we were unable to secure participation from one of the agency partners or a topic from within our own area. I try to get a posting up there early in the week so people know that they can come and see if there's going to actually be a webinar that week or not. So if you haven't seen it through email, or maybe you aren't on the email listing, you can come to this same link on a weekly basis and look for us. So hopefully we'll see you in the future, and look forward to these continuing on with our agency partners. Thank you, Gail and Lisa, for your presentation.